Joining me now to talk more about it, Dr. Kristin Englund. She is an infectious disease specialist at the Cleveland Clinic. All right, so what misinformation do you feel is most important to clear up? What do people think that's wrong about this new variant and the boosters?
So unfortunately, information has been spread that the vaccines, getting a vaccine is what's causing this virus to mutate more. And that couldn't be further from the truth. We do know that the less virus that is around, the less likely it is to mutate or combine and be able to spread more rapidly. So the vaccines, while not perfect, certainly do decrease the amount of virus that's in our communities, and it also protects those of us who get the vaccine from either getting a very severe illness, being hospitalized, and even dying.
It must be difficult for you in the medical community and others to combat misinformation like this. How are you trying to do that, and what role does the public more broadly play in helping?
Well, certainly what you're doing here today really helps a lot for us to be able to get good information out. So much of this is really the one-on-one conversations that we have with our patients every day. A recent study showed that in the emergency room, their efforts at getting people to be vaccinated when they have a one-on-one conversation with the physician really increases the number. So I think more public education about the real benefits of this, I think for people to understand that the goal of vaccines is not to get rid of all infections, but it's to keep people out of the hospitals. People get frustrated when they get the vaccine and then still get ill. Well, you're going to get ill. There's a good chance that you'll still get exposed to COVID, but you're not going to end up in the hospital, and we're certainly going to be able to keep you from dying.
Right. The same is true for the flu, right? You can still get the flu even if you've gotten the flu vaccine. I know you all have been combating that for years. Let's talk about XBB 1.5. I mentioned a few of the characteristics of this latest strain. What's most important that you're noticing about its transmission?
So certainly it is. The World Health Organization has said it's the most transmissible virus, but we are not seeing that it is much more deadly or virulent at this point in time. The more numbers of patients that are getting exposed, we are going to see increases in hospitalizations and increases in death, but that is not increasing more than we have seen with prior strains, and certainly not nearly as bad as when we first saw the Omicron variant about a year ago.
How's the booster handling this new variant and others?
So the booster is not perfect. It certainly is going to be helpful in keeping people, again, from being hospitalized or dying from it. So we are strongly recommending people still get the bivalent vaccine, and only about 15% of people ages 5 and older have gotten the vaccine, the bivalent booster vaccine in this country. That's not going to help us get rid of this infection.
What's causing that? Is it just fatigue, right? I've already had a few. Do I really need to go do it? Is it the misinformation? Is it a combination of the two?
Oh, I certainly think it's a combination of both. I think people are tired of hearing that they need to get another booster. They're confused by, well, if I've already had 3, is this one really different? They need to be questioning if they've gotten the bivalent booster. That's the most updated vaccine and the one that's going to offer the best protection. The early on boosters that were against the first strain of COVID really are not tremendously effective at this point in time. The bivalent booster is going to give you the best chance of not getting seriously ill.
I'm hearing more and more stories of people that are dealing with the lingering symptoms of long COVID. Now that we're a few years into this, do we know anything more about how long COVID lasts, some ways to help combat it?
Yes, thank you for bringing this up. I run the long COVID clinic here at the Cleveland Clinic, and our numbers are continuing to increase. I've got folks who've been having persistent symptoms for 2.5 years now. So this getting COVID, even if you don't get a severe COVID infection, you can still get long COVID. And the symptoms of fatigue, brain fog, lack of sense of smell, the GI upset, there's a lot of symptoms that can go along with PASC. And there's reason to believe that the more times you get exposed to COVID, the more likely you are to get this long COVID or PASC as well.
All right, get vaccinated, the best way to protect yourself and others. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.